Welcome to Taking the Pulse, a healthcare and life sciences podcast. I'm Tina Emerson, here with Maynard Nexon healthcare attorney Lauren DeMoss. Good to see you, Lauren.
Good to see you as well, Tina.
Joining us today is Magnetic Insight co-founder and CEO Patrick Goodwill. Magnetic Insight is a pioneering and new diagnostic and monitoring technology that aims to transform medical imaging. Patrick has spent nearly a decade working on magnetic particle imaging at the University of California at Berkeley. Thanks for joining us today.
Great to join you.
Patrick, can you share the journey that led you to co-found Magnetic Insight and what drove you to research and develop these new imaging technologies in the medical field?
I'd be happy to. So I started this journey nearly 20 years ago. I left a job in the semiconductor business, went back to grad school for the second time, and I met my advisor and later co-founder of the company. And we saw a new technology and thought, how hard can it be? So that was 20 years ago when we started. First few years, we started working on theory and building small scanners, and we rapidly started to outgrow what we could do in the university. And through all of this, this was, 15 years ago at this point, I got married, but then my wife got sick and passed away rather suddenly from brain cancer. So the situation is now it's about 10 years ago. I just had a family tragedy. I have a technology that can change medicine and specifically cancer care. And so I resolved to get what we were working on into the world. I left the university and I founded Magnetic Insight. So since then, we've brought the technology to universities like this right here. We've shipped 14 of these into 4 continents. And now we're building a clinical system so that we can get it to clinicians and we can truly affect cancer care.
And those of our podcast viewers who are watching this on video and not just listening to it, tell us what that is behind you.
So this is one of our Momentum preclinical scanners. This is for imaging mice. And it has an integrated CT that's not shown here. It's behind the wall over here. And it lets us do both MPI, which is our technology, and a X-ray CT and co-register them. And you get a much better picture of what's happening in the animal.
Patrick, magnetic particle imaging technology is probably something that people hear you say and think, okay, I kind of from, 7th grade science can put a few pieces together. But could you maybe explain a little more in layman's terms how the technology works and what the advantages are over kind of a traditional just MRI or CT scan that one might receive?
Of course. So we've seen MRIs and CTs, probably on Grey's Anatomy, and many of us have had to get scans ourselves, including myself. So our technology, which we call MPI, is a new version of these, but it's based on a different underlying physics. And what our physics lets us do is we see a magnetic tracer exceptionally well, and we don't see tissue at all. So this is very different than the MRI or CT scanners that we're familiar with, which only see tissue structure and don't see a tracer. So the idea is that the tracer lets us get a lot more sensitive information about the patient's body than what we can just by looking at the tissue structure, such as if a patient's cancer is spreading, and we can do that in just a few minutes. So it's just a different technology underlying than what we have existing, and it gives us very different information.
And in the treatment of cancer, tell me how that assists with that treatment. I know looking at the tracer and being able to see a little more deeply, how is it applied in some of the partners that you're working with to send this technology to?
Sure. Let's see. So when treating cancer, what's important is getting the patient the right treatment at the right time. So we go through diagnosis, staging, treatment following, and we do this all with medical imaging. So we can do this in a couple ways. What we call functional imaging is where we see how this tracer that we put in flows through the body. And then we can use this functional imaging to see if a patient has a cancer. And we can stage their cancer, see if it's, say, spread to their lymph nodes, if it's spread to their lymph nodes, they need to get more aggressive treatment. So MPI also has an application, one of the most promising new areas of cancer care, which is personalized medicine using engineered, say, CAR T cells or CAR NK cells. And right now, we'll administer one of those treatments and hope that it's working, which is not a really good clinical decision maker. What MPI lets us do is to give us visibility to the treatment so that we can see exactly where the cells go, if they make it to a tumor, and if they're working correctly. And so if the, say, dosing or treatment regimen needs to be adjusted. So with those, functional imaging and cellular imaging, we call it, when we're looking at CAR T cells, we can really change how we treat cancer.
Patrick, is it used for certain types of cancers more frequently, or can it be used for, I know, you mentioned brain cancer in your wife. Is there something, is it used more with brain cancer, or can it be used with any sort of cancers?
It can be used with any sort of cancers. I'll give you a few different things that we're working on right now. So for example, we're working on head and neck cancer and looking at sentinel lymph nodes to see if cancer is spread. We can also do the same thing in the breast and gynecological. For looking at brain cancer, we're looking at location and treatment following. And then finally, we're also looking at this technology can also be a treatment in and of itself. And so we're looking at those, examples, but there's a huge slew of other applications underneath this umbrella that can really change how we treat cancer.
Can you tell us about some of the partnerships that you've had? And I say partnerships, I guess some of the medical institutions that have your product and your technology in demand, that they can really use this to fulfill their obligations to treating patients.
So like I mentioned before, we've shipped this system to four continents now, and with 14 locations. Some of these locations are the Johns Hopkins. We have one at Stanford. We have one at City of Hope over here in California. And we have if we think internationally, we have a system over at Karolinska Institute. That's where they hand out the Nobel Prizes. And what these customers and partners are working on are really new ways of diagnosing and treating cancer, whether it be, again, through detection of the disease or treatment following, say, tracking CAR T cells. Our first system many years ago was over to collaborators over at Stanford, and that was almost 8 years ago now. And since then, it's been through hundreds of different research studies and it touching in all sorts of different areas.
So Patrick, you've mentioned, it's interesting. It can be used, initial diagnosis. It can be used, I guess, to stage the cancer when you're talking about looking at lymph nodes and where the cells are traveling. Is it also used, I guess, intermittently or during treatment, by way of example, before a patient receives radiation or makes a decision to receive radiation, or looking at potential lymph node involvement? Is it also used in that kind of stage of the disease too?
It really is. It really is. So we're working with MD Anderson right now to look at MPI as a way of treatment staging, where patient's been diagnosed. We're going to go see if there's lymph node involvement, and that's where this comes in. And so if there's lymph node involvement, that directly drives how aggressively the treatment is given to the patient. So do they take out 1, 2 lymph nodes, or they take out 18 or 20 lymph nodes? And you choose that based on if you've detected in a biopsy after you've done the imaging. Likewise, if it's spread, as you mentioned, it will drive aggressive treatment with radiation. There's a whole other area that we also apply to, which is the direct treatment of cancer. So we're in the process of, we're very close to getting this grant from the NIH. And what we're going to do with Johns Hopkins is explore MPI technology and RF hyperthermia, which is very related to this and uses the same equipment to directly treat cancer as an adjuvant, so in addition to radiation and chemotherapy. So essentially, a patient's receiving a treatment for brain cancer, and this is what we're studying specifically. Can we use MPI plus radiation plus chemotherapy to form a more effective treatment?
And that is truly life-changing and life-saving for a lot of people. How do you see MPI and magnetic insight changing that medical imaging landscape? It seems like what you're talking about is quite groundbreaking.
Yes. The way that we see this is we're the world leaders in this technology, and we're very excited to bring this technology to hospitals and scanning centers. And the goal is that we impact the greatest number of patients. Our our vision is that MPI will be as fast and easy and as common as getting an X-ray CT or an MRI. It'll just be one of those things where people will go in and just you get the scan and it tells the doctor what they need to know based off of the functional information that's coming out of the body. Now, we've taken some really big steps to get to that vision. Again, we've shipped these all across the world to 4 different continents. And now we're building a clinical system to get this on testing on people this year.
That's fantastic. What kind of challenges do you anticipate in bringing those advancements to the world?
Some of the challenges that we see are the challenges that we see with any new technology. So it's a long road filled with a lot of trials and tests, really to demonstrate its clinical value. And that's to the patient, the care providers, the medical system. It's a whole process to get this not just to the clinic, but we're very confident that we will be there. The next step after that, and which we're planning for right now, is how do we become the standard of care? How do we become that system that I described that's fast, easy, and as common as getting an X-ray or a CT?
Well, I was thinking as you were talking, Patrick, you think about MRI and CT and, in terms of in a hospital setting and, the construct of, how thick the walls have to be and all I assume that applies here too, the same kind of thickness of wall, all of those different, trying to think of the word, the requirements have to be in place, right? The safety requirements when you're looking at, MRI, CT, radiation, I'm assuming MPI is kind of under the same scope.
That's correct. We are similar in scope to MRI and CT, and the requirements to put one of our systems in a hospital are going to be very similar.
I'm sure it is regulated in some way. Can you talk to us a little bit about the regulations that you might be under for compliance for creating this type of technology? What are the kind of things that you need to adhere to before you can put this together and send it to a place like MD Anderson?
Yes. So the rules and regulations that we live under are the same rules and regulations that MRIs and CTs live under. We use large magnetic fields. So when we look at the regulatory documents that are out there, we look very much like an MRI. In fact, what we've done is we've taken the MRI documentation, the MRI requirements for magnetostimulation, SAR, and a few other safety requirements, and we've adapted them to what we're doing. And we're in the process of already putting in the investigative device exemptions to IRB and soon the FDA. And we've structured all of it around that, saying, hey, we magnetically look like an MRI. We're not related, but magnetically we look like it. We fall under the same safety requirements. And this great precedence really shows, and this is through all of our work, that we're very safe. We are as safe as, say, an MRI is to a patient. And that makes it so the path to let us get to testing is very reasonable.
Mm-hmm. As we wrap up here, I just want to thank you for this technology, because in hearing about it, it seems like it's extremely needed in the healthcare community. And it really seems to cut down the time that it takes to diagnose people who are desperate to know what's going on and desperate to get treatment for cancer. And thank you for everything that you're doing in the community. And we really appreciate your time today.
Well, thank you so much. And I did want to add one last thing, which is,
of course,
we're always looking for partners. So to anybody watching this podcast, please reach out.
Thanks so much, Patrick. Thanks again for being with us, and we'll see you next time on Taking the Pulse.